buddy. I appreciate you checking this out. It's going to take about 10 minutes. And this first slide I'm going to change. I'm going to leave the lung picture, but the hot chick coughing, that's just a placeholder. It's a Zoom, so there's going to be a video of me in that little box. And it's going to sound a little rehearsed, but I tried my normal impromptu style. I had to go full-on presentation. There's like 2,000 people watching this, so freaking me out a little bit. Anyway, I'm going to follow my colleague, Lynn Lewis, who's going to tell us about the virus. So I'll start out saying, thanks so much, Dr. Lewis, for that interesting information on the coronavirus. And also, thank all of you for your interest in this topic and for your overwhelming support for UMW. It's really a great honor to be able to speak to all of you today on such an important topic. Now, I'm going to switch gears a bit and talk specifically about the effect that this virus can have on the human body. Now, the coronavirus can cause the disease COVID-19, which can result in severe lung disease. As you can see here, a healthy pair of lungs compared to a pair from a patient suffering from a critical case of COVID-19. Now, these white marks you see here are indicative of massive levels of inflammation caused by coronavirus infection. But it is important to note that not everyone who gets infected with SARS-CoV-2 develops COVID-19. In fact, as many as 80% develop no symptoms at all. This is in part good news for those people. However, this characteristic of SARS-CoV-2 can perpetuate and accelerate the spread of this virus in a population. Considering cases of COVID-19, over 80% of cases are classified as mild and include symptoms like fever, aches and pains, and a persistent cough. Now, importantly, pneumonia, which is inflammation in the lungs, is not observed in these cases. More severe cases do exhibit pneumonia, which can lead to a decrease in levels of oxygen in the blood, which we term hypoxia. These patients may require some hospital care, including oxygen therapy or anti-inflammatory drugs, but are not quite as progressed as the small percentage of cases that we call critical. These can result in multi-system organ failure and potentially death. Now, these patients typically possess one or more pre-existing conditions such as cardiovascular disease or other metabolic disorders. Now, all of these symptoms involve the respiratory system, and the SARS-CoV-2 virus primarily spreads through respiratory droplets being inhaled. Therefore, we should really begin our discussion by exploring the anatomy and the physiology of the respiratory system. So the basic purpose of the respiratory system is to allow us to take in oxygen, which is needed to turn our food into energy, and to let off carbon dioxide, which is the breakdown product of the sugars and fats that we consume. So here we have this nicely drawn model, Steve, who's going to stand in for our respiratory system model. Steve takes a deep breath, inhaling oxygen-rich air, which enters his nose and mouth and travels through a series of tubes, including the trachea and bronchioles, to get to his lungs. Now, if we look at Steve's respiratory tract in a bit higher definition, we can see that it is lined with a nice moist layer of epithelial tissue. This tissue extends from Steve's nose and mouth all the way into his lungs and serves to hydrate and warm the air as it enters his body. Importantly, the epithelium in Steve's nose secretes massive amounts of mucus to trap any particles, including viruses, that may enter Steve's body. If we zoom into the lungs, we can see that all of these tubes lead to tiny sacs called alveoli. Now, this is where the gas exchange actually takes place, and the alveolar sacs are lined with a dense mesh of tiny blood vessels that you can see here called capillaries that pick up oxygen and deliver it to the rest of the body. Now we can zoom in just a bit further and look at the individual cells that make up the alveoli. In this image, the purple sacs represent the alveoli, and these small pink circles right here represent the capillaries that bring blood to the alveoli. The purple cells, shown here, are type 1 alveolar cells, or pneumocytes, and these cells help to move oxygen from the alveoli into the blood in the capillaries. Another important type of cell here are the type 2 pneumocytes, shown in yellow. These cells are not directly involved in gas exchange, but secrete a lubricant into the alveoli that allows them to expand when you inhale. In this way, the type 2 cells allow us to take full deep breaths to fill our lungs with sufficient amounts of oxygen when we inhale. Now we'll put Steve into a social situation with Jim. Jim's telling Steve a compelling story about his weekend plans, but unfortunately, Jim is infected with the coronavirus. When Steve inhales, he takes some of these virus particles in. In most people, these particles will get trapped by the mucus in the nose and mouth and simply stay there. However, sometimes these virus particles can end up in the lower parts of the respiratory tract, including the lungs. If you remember from Dr. Lewis's slides, the SARS-CoV-2 virus enters the cell using this protein here, the ACE2 receptor. The reason that this virus can infect the respiratory system is that the epithelium that lines the respiratory tract possesses high levels of ACE2 receptors. This includes the tissue in the nose and trachea, all the way down to those pneumocytes in the alveoli. Now, the cells that express the highest levels of ACE2 receptors include the type 2 pneumocytes located in the alveoli. So if the virus enters the lung, it can attach to the type 2 cells and turn these cells into virus-producing factories. This can kill those type 2 cells, eliminating the lubricant that these cells produce. And without this lubricant, to increase the flexibility of the alveoli, the lungs functionally collapse, and the patient can enter a state called acute respiratory distress syndrome, or ARDS. This syndrome is similar to the restrictive lung disease that we see in long-time heavy smokers, but in this case, hits the patient rapidly and intensely. Another effect of the rapid and widespread death of these type 2 pneumocytes is the release of cytokines. These chemical messages attract components of the immune system to come and fight off an infection such as SARS-CoV-2. Unfortunately, in the lungs, this is bad news. High concentrations of these cytokines can lead to intense levels of inflammation and swelling in the lungs, which increases the distance between the alveoli and the capillaries. And this disrupts the ability of the type 1 cells to deliver oxygen from the alveoli to the blood in the capillaries. So in two ways, coronavirus disrupts our ability to obtain oxygen. First, our alveoli are unable to expand, making it so that we cannot fill our lungs with air. And second, the air that we do get into our lungs has a difficult time reaching our bloodstream. Now, the vast majority of cases of COVID-19, even those that become critical, this makes up the extent of the symptoms that present in a patient, and is actually on the more severe side. In most cases, the epithelial tissue in the nose and mouth catch the virus and do not allow it to infect the lower respiratory tract, including the lungs. However, in some critical cases, clinicians have observed symptoms outside of the respiratory system. These can include almost any organ system in the body. In the cardiovascular system, COVID-19 can result in clotting disorders, stroke, and can even instigate a heart attack. In regards to the digestive system, many patients report experiencing nausea and diarrhea, and in a very small number of cases, kidney and liver failure have even been observed. We don't yet know if these symptoms outside of the respiratory tract are a direct result of the coronavirus infection, or if they're a secondary symptom of inflammation that is associated with the cytokine storm. There is, however, evidence for both of these hypotheses. All of these organs, the heart, the stomach, the blood vessels, kidneys, and intestines, are lined with epithelium, and just like the respiratory tract, these tissues express high levels of ACE2 receptors, making them susceptible to coronavirus infection. However, the time course of these symptoms, which typically appear many days to weeks after infection with the virus, suggests that they result from the body's reaction to the virus instead of the virus itself. We're quite early in our investigation of this disease, and will likely figure out this key aspect of COVID-19 in the months to come. On this note, in just the past 4 months, multiple therapies have been identified to treat the symptoms of COVID-19. This diagram from Dr. Lewis's slides shows the mechanisms of SARS-CoV-2 replication. Some therapies, such as remdesivir, attack the proprietary enzymes that the virus uses to hijack the cell's physiology. Other therapies, such as antibody or nanobody therapies, actually block the virus's access to the cell through this ACE2 protein. Finally, other therapies attempt to disrupt the cytokine storm associated with the most critical cases of COVID-19. By attacking this disease from many fronts and many angles, we are most likely to develop therapies that can bridge the gap between the emergence of this pandemic and the development of an effective vaccine. Now, these symptoms of COVID-19 can definitely be devastating. All the while, it is important to remember that the vast majority of cases of COVID-19 are asymptomatic or mild, and that the symptoms that I have just described are only associated with the more severe or critical cases. So I'll close there and hand it over to Dr. Morris, who is going to talk a bit more about the evolutionary mechanisms and the molecular processes that are associated with SARS-CoV-2.